I'd like to bring up our speaker this evening, and the man who's going to start the event is someone who's well known throughout the area. He's spoken at the church before, not this particular location, but as many of you know, we've moved from Hollywood up here to Pompano Beach, and we're so glad to be closer to Dr. Maharaj's institute, the Maharaj Institute. Come on up. Yes, come on up. Thank you.
Hello. Thank you, Neil, and thank you to everyone in the audience here and the audience online for having me to be here to speak today. I'm not the only one going to speak. We're going to have three other speakers, but we're all going to talk about the common goal that we all have, which is that everyone here is interested in healthy life, right? Healthy health span. And that's essentially what our common goal is. I'm not sure, I think we all have eternal life, but that's my own belief. But while we're here on earth, we want to be as healthy as possible. So my goal today and our goal today is to create amongst you and everyone the awareness of a particular study, clinical trial, that we are doing at the Maharaj Institute in Boynton Beach. And this particular study, the unique aspect of this study, and the title is GCSF, Stem Cell Mobilized Young Donor Plasma to improve the immune system and to overcome the frailty that is associated with aging. It's an ambitious project. We have to do it as a clinical trial because we cannot assume that because you give someone young plasma, it's going to work. So that's the reason why we're doing it as a formal study. The other speakers who are going to speak would be Dr. Kurt Whittemore, we have Dr. Dan Flynn, and we have Dr. Dan Mangru. Dan Mangru, okay. Dr. Whittemore did his research on telomere shortening or lengthening, and he comes to us from the Harvard Medical School where he did research on stem cells. He's also a Fulbright scholar, and so is Dr. Flynn. And Dr. Flynn was formerly the Vice President for Research at Florida Atlantic University. And so he has an extensive background in taking research and in being able to translate that into making it beneficial to individuals. And so we're very fortunate to have scientists affiliated with us like Dr. Flynn and Dr. Whittemore. Special introduction is to Dan Mangru. Dan is a very extremely talented businessman. He owns his own business. He's worked in biotech, and he currently is running a biotech fund now to be able to develop a program which when you go to the cinema, it can help you to translate. Anyway, they will actually speak themselves and give you more information about this. But I want to make sure that we all understand that the subject that we're talking about, how important it is and what we want to do. So my personal connection to this subject is based upon my years of research. I did my first stem cell transplant in 1982. And so at that time, what I learned about stem cells is that essentially they are the mother cell in the body. And in every organ, there are stem cells that actually undergo differentiation to produce the particular organ. But the most important stem cells that we are working with, they're called hematopoietic stem cells. And these stem cells actually forms the immune system and the blood. Most people are familiar with their blood counts and they look at it and they say, I'm fine. But in fact, we'll talk more about the effects of aging of the stem cells and how it affects the immune system. I also trained as a hematologist, and I was one of the first doctors in the United Kingdom to use the protein GCSF. GCSF, it's a natural protein. It helps to release stem cells from the bone marrow into the blood. And so that's another aspect. I also trained as a pathologist. And as a pathologist, I basically learned that we could actually take plasma and how to separate plasma from the blood. We also, as a bone marrow transplant physician, our primary objective was to restore the immune system of individuals whose immune systems had broken down. So by combining all of these together, this is the reason why we came up with this protocol, to use the stem cells mobilized by GCSF from young donors to be able to give it back to individuals who are aging, to restore their immune systems, which would then allow them to stop the progress of chronic diseases, including cancer. Our institute is over 23 years, has had 23 years of experience. It's totally outpatient, it's Joint Commission accredited. It's also accredited by the American Association of Blood Banks, which means that the stem cells we collect are basically stored in our facility, in our stem cell cryobank. So we have quite a lot of experience in terms of stem cells and the use of these stem cells. But the stem cells that I'm talking about, they're called hemopoietic progenitor stem cells. And when anyone hears the word stem cells, they think really the stem cells can do everything. But really the area of focus we're talking about is really to look at how the stem cells that forms the blood and the immune system. And that's basically the stem cells that we're talking about. Now, in the creed, one of the objectives of the creed was to basically have healthy aging. And that's what we're all interested in, which is the maintenance of maximal function throughout our lives, and or for the maximal period of time that we can. We have to be able, if we're going to say we want to achieve maximal health span, we must be able to measure that. And we must be able to use objective markers which have been studied in population studies and have been proven to do so. And one of the markers that we're using in our study is a clinical marker called the frailty score and frailty index. And so if you look at this slide, it's basically telling us that our performance is measured on one axis, which is the frailty, or basically our performance, and on the other axis is aging. Yes, the blue zone, or the blue area, it's between the ages of 20 and 40. And so individuals between the ages of 20 and 40 who are healthy, they have health span during that period of time. But however, after 40, we have a decline of the immune system. And so individuals begin to become frailer. But it's not noticeable, usually until someone becomes age 55. And then after age 55, it begins to decline faster. And at age 65, now there's a rapid decline. And the gray areas in that graph basically are showing the areas, the people who have a chronic disease. In the United States, 6 out of 10 adults already have a chronic disease. And trillions of dollars are being spent to be able to correct, but it's not correcting, it's treating the symptoms. And so we have an ambitious project, because what we want to be able to do is to see if we could use the stem cell factors contained in young donor blood, whether that can actually push someone's immune system back up to between the ages of 20 and 40, or certainly push it back up, and then also show an improvement in their frailty index. So the frailty index is defined as basically an index which measures a number of functions of an individual. On average, it changes by 3% per year. So if we are able to show a reduction of that 3% per year in the people who we are treating, then we would have a successful outcome. So with aging of the immune system, which again starts after 40 and at 65 it takes a nosedive, these are the diseases that tends to occur. People get chronic inflammatory diseases, infections, cancers, autoimmune diseases, and frailty. That's one of the characteristic features. And that process of aging of the immune system, which causes the chronic inflammation that causes these diseases, it's called immune senescence. And that is really the issue that we've got to solve. As a society, as an individual, as a group, that's basically what we want to solve. So the question is this: if we want to solve the problem of aging, we have to understand the process of aging of stem cells, which forms the blood and the immune system, but critically the immune system. So in our bone marrows, if you look on the left of the slide, you will see it's, again, the question is, how do we, to be able to understand aging and aging of the immune system, we've got to be able to understand what happens to the stem cells, which are in the bone marrow, that forms the blood and the immune system. If you look at the slide, you will see it talks about compartment 1 and compartment 2. Compartment 1 is really a reserve tank within the bone marrow. When we're born, we have about 20,000 to 200,000 stem cells that are deposited there. And from these stem cells, every year, one cell will move over into the differentiating compartment and form the blood and the immune system. And the cells of the blood are red cells, white cells, and platelets, and the cells of the immune system are B cells, T cells, and natural killer cells. But as we age, the cells that forms the blood, or the stem cells that forms the blood, they age at a different rate compared to the stem cells that forms the B cells, T cells, and natural killer cells. And that's basically the aging process that occurs within the bone marrow that causes dysfunction of the immune system, and it causes us to have, at age 40, our immune systems begin to decline. Now, it's possible to measure that, and the measurement of that is done with a blood test called the immune risk profile. The aging of the stem cells that occurs is basically, which is senescence. There are multiple mechanisms by which that occurs. And if we're going to solve the problem of aging, we've got to identify where the defects and what are the problems that occur within each cell. And these are called the hallmarks of aging. There is genomic instability, where the DNA of the stem cells become damaged. There's also telomere attrition. And the telomeres, pluripotent stem cells, or stem cells which are destined to be with us for a long time, they undergo telomere lengthening and telomere trimming. And that process is well balanced. But in cells that are actually aging, that process is imbalanced, and eventually the cell gets to a point where it stops dividing, and that's called senescence. There are other mechanisms as well, and if we look at each one of these, there is evidence that young blood plasma done in experiments in different labs in different animals have been able to show that each one of these areas associated with aging of the stem cell or senescence has shown improvement. So one of the most important things that we have to understand, or one of the most important pathways that occurs in senescent cells, which are aging cells within the bone marrow, stem cells, is the fact that certain pathways, and one of the most important pathways is what we call the insulin resistance, or IGF pathway. And it has been shown that stem cells that undergo senescence, they're very similar, or aging, they're very similar to cancer stem cells, where there's something called the Warburg effect, and that is these cells now begin to absorb and utilize glucose in a very, very fast way, and they capture the glucose from the environment, and they utilize it at the expense of the other cells. So in essence, if we can capture and we can understand this mechanism, then we can actually also help to improve it. There's also evidence that young blood plasma done in different experiments in mice can actually improve this mechanism. Not only is there damage to the stem cells from the what we call intrinsic factors, that's within the cell itself, but the environment in which the stem cell lives in the bone marrow and other organs can cause damage as well. So exposure to toxins, any type of toxins that we're exposed to, will actually cause damage to our stem cells. So it's possible to basically differentiate between healthy and senescent cells. And there are certain markers that we use when we look at the blood count to be able to determine when that is occurring. The process that senescent cells go through is when they produce inflammatory cytokines. And these inflammatory cytokines produces chronic inflammation. And the diseases that we're exposed to and we get as we get older, or chronic inflammatory diseases, and it's produced as a result of these different cytokines, which we can measure. Now, this slide may be a little bit more difficult to see, but as a pathologist, when you look at the slide on the left, basically it looks as it's the bone marrow of a healthy young person. The slide on the right is the bone marrow of an aged individual, and where the stem cells in the bone marrow have actually undergone senescence and produces a lot of inflammatory cytokines, and it creates these spaces filled with fat. That fat is very similar to visceral fat, or the fat that we have around our organs, which is an inflammatory tissue. And there's a battle going on between the inflammatory tissue and the normal stem cells, where as there's more inflammation occurring, these normal stem cells, which are there to basically restore immune function in our blood, they decrease. So looked at another way, in a young person, there's a balance between inflammation and anti-inflammation. But with aging, the chronic inflammation that occurs as a result of dysfunction of the immune system causes damage to our tissues, and it can affect different organs in different ways. So aging is associated with chronic diseases caused by a chronic inflammatory process, caused by immune dysfunction, caused by senescent stem cells within the bone marrow. And that's really the way that diseases occur. And if we're going to solve this problem of aging, we've really got to understand this very clearly. So there are different interventions which are currently being explored in clinical trials to be able to go after each one of the mechanisms by which cells become senescent or become aged. And our approach is a straightforward approach. And that is, in young people, their stem cells are producing factors which basically keeps them young and prevents these different mechanisms from occurring. Well, if we were to take the factors from the stem cells of a young person and put it and incorporate that into their plasma and give it to an aging individual, then hopefully we will achieve the same thing as a young person does. Now, I want to be very clear. In our study, we're not taking the stem cells from the young donor and giving it back to an aging individual. And why is that? In my years of experience as a bone marrow transplant physician, if you take stem cells from one person who is not related, and you put it into a person whose immune system is deficient or dysfunctional, those stem cells will go in from the young person and they will engraft. And that will create a disease which is an autoimmune disease. And initially the person might not see it, but in the long term it's going to shorten their lives. So the way we got around that was saying we're not taking the stem cells from the young people. When we collect the stem cells, after they have been mobilized by GCSF, we will freeze the stem cells. But we will take the plasma, and the plasma contains all the factors. It contains cytokines, it contains growth factors, it contains extracellular vesicles. It also contains mitochondria that came from the young stem cells. Those are frozen, but the plasma is now enriched. So there are many studies which are basically using young blood plasma. There are many studies using stem cells. But what we're saying is that we want to avoid the toxicities associated with taking somebody else's stem cells, particularly a young person, and putting it into an aged person and running the risk of graft-versus-host disease. Because our primary objective in this study is really safety. We want to make sure that we do not cause any harm. We want to get good results, but we want to be very careful about how we do it. Now, I will stop, and I'm going to ask Dr. Whittemore to come up and just talk a little bit more about the science and the studies that have been done.
Thank you, Dr. Maharaj. So I'll just go through a short history of young plasma and young blood treatments. Before that, I'll just tell you briefly about myself. So I got a PhD at Arizona State University, where I was working on peptide microarrays. And then after that, I went to Madrid, Spain, and did telomere research. There was two main projects I was working on there. One was to do telomerase gene therapy on mice, and we found that this ameliorated neurodegeneration in old mice. And then the second study was that we collaborated with the Madrid Zoo, and we measured the telomeres in many different species at many different ages. And we found that the telomere shortening rate, but not the initial telomere length of a species, was very correlated with lifespan. I then went to Harvard Medical School and did research on gene therapy for inflammatory bowel disease. And now I'm here at the Maharaj Institute of Immune Regenerative Medicine, and I'm helping to manage this young plasma clinical trial. So young blood has the idea that it could be used to rejuvenate older people has been around for a long time, since the 1600s. So Andreas Libavius, he was a German physician, and he thought and proposed that young blood from a younger man could rejuvenate an old man. He wasn't able to really try that at the time. And then in 1660, Robert Boyle, he came up with the Boyle gas law. Some of you might be familiar with that equation. So he wrote about the prolongation of life, and he said this might be achieved, he hoped, by replacing young blood with replacing old blood with new. Then in 1957, Clive McKay did some interesting experiments. So most people might know Clive McKay for his calorie restriction studies in rodents. But he also did these experiments with parabiosis, where mice were surgically connected to each other. And parabiosis had been around for about 100 years before this time. But that was used to study things like hormones and organ transplants. So Clive McKay was the first to surgically connect an old mouse and a young mouse together. So that's called heterochronic parabiosis. So he connected old rats, 5 to 16 months old. So remember, rats only live like 2 to 3 years old. And he combined those with 1 to 2 month old rats. And he noticed that they tended to survive longer and maintain better health. So in this preliminary study back in 1957, they published the paper before all the rats had lived out their lifespan. So they didn't have the life extension curve. About a decade later, another study was done where they, again, did this heterochronic parabiosis, and they connected old rats with young rats and measured the lifespan. And so this curve right here is just for the female rats. And the curve on the very right, I think it's kind of hard to see in small, but the curve on the very right is for the older member of the pair. And it actually lived longer than the curves in the middle. In the curve in the middle, they have mice that were not connected to any younger mouse. And in this study, they sacrificed the mice as soon as one member of the pair died. So the younger mice actually have like the shortest lifespans on the left there. So they found that the older rats lived longer lifespans when connected with younger rats. So for males, the effect was not as strong. It was 18 days longer for males on average, and for the females, it was longer, 95 days longer. So after this 1972 study, the field kind of languished for some time, and not much was done with young blood rejuvenation. But then in the early 2000s, it started to pick up again. So at Stanford, they tried this heterochronic parabiosis again, and now techniques are more developed and technology had advanced. And here they connected 19 to 26-month-old mice with young 2 to 3-month-old mice for 5 weeks, and then they separated them. And that they found that there was enhanced muscle and liver regeneration. So in this graph, this is a graph showing Ki67 positive hepatocytes. So Ki67, that's a marker for proliferation, and the hepatocytes are the liver cells. And so on the right two bars, those are from the aged mice. And the very right bar is heterochronic aged mice. So it's an old mouse connected with a young mouse. And there you see there's much more Ki67 positive hepatocytes. So this younger blood, that even though those cells were very old, they were somehow rejuvenated by being exposed to the young blood from the young mouse they were connected to. Then in 2014, another study was done in heterochronic parabiosis, and here they measured the proliferative potential of muscle stem cells. And once again, so on the right-hand side, you see the age groups. So there's the aged isochronic in black there, so that's just an aged mouse connected to an aged mouse. And on the very right, the gray bar, they have an old mouse connected to a young mouse. And there you see the bar goes up, and there was more colony formation from the stem cells, indicating the stem cells were able to regenerate and proliferate more. And in that particular study, they identified GDF11 as a very important protein responsible for this effect. Also, that same year, in 2014, a different group, instead of doing heterochronic parabiosis where they surgically attached two different mice, they instead just injected plasma from young mice into older mice, and they observed very good effects. So they had 18-month-old mice and injected them with plasma from young 3-month-old mice. They did that 8 times over 24 days. And then they measured the mice's memory. So they did this with a radial arm water maze where the mice are submerged in water and they have to swim, and only one arm in this maze has a platform that they can stand on. So they're kind of trained in this maze for a while, and then later they test to see if the mice can remember how to go to the arm which has the platform that they can stand on. So the graph here is measuring the number of errors the mice make, the number of wrong arms they go into before going into the correct arm. And after the training is on the left, on the right they have the testing. And you can see that when they're given the young plasma, they make significantly fewer errors than the aged plasma group. So the young plasma was able to improve the memory. And in this study, they focused on the CREB protein as being a key mediator of this process. So other groups have also just simply tried to dilute the plasma. So instead of getting old plasma, they just dilute plasma, and they also found some good effects. So in this study, they took out half the plasma from the animals and replaced it with saline containing 5% albumin. And then they measured the fibrotic index in the liver. And so on the very right with the red triangles there, you have the old mice that were given blood from old mice. So they have the most fibrosis, which, that's not good. But then to the left of that, you have old mice where half the plasma was replaced with the albumin saline solution. And there the fibrotic index was decreased. So clearly there are bad factors in old blood that when that is diluted, that alone can be helpful. So with this study, I'm just showing a graph for the liver, but they observed improvements in the muscle, liver, and the brain. And then in quite a recent study in 2023, a group with Harold Katcher, they did this study where they actually used plasma across species. So they took plasma from young pigs and they put those into old rats, and they noticed a lot of great effects. So they found that the epigenetic age was reduced. So this top right graph is the DNA methylation age. The red bar is the old rat control group. The middle blue bar is just the young rats. And then the orange bar on the very right are old rats that had been treated with this young pig plasma. Actually, specifically, they used a specific fraction of the plasma, so they referred to it as E5. They also measured, and you can see the DNA methylation age was greatly reduced, almost to a young age there. So they found some incredible effects. They also measured cognitive function. And so they did a Barnes maze test, measured the amount of time it took for the mice to reach the correct hole in this Barnes maze. And so the red on the very top is the old group. They're taking the most amount of time to find the hole. And then the orange group is the old rats that were treated with young pig plasma, and they almost reached the blue group, the young group there. So it significantly improved their memory. So it's quite surprising and interesting that this effect could even work across species like this. And in some of the previous studies, I was mentioning how they focused on one particular factor or another. One group was saying, GDF11 was really critical. Another group was pointing out that Krebs was very important. But in this study, they looked at what is in this E5, and it has many exosomes. And these exosomes and extracellular vesicles inside of them, they have all kinds of different factors, including RNA. And one thing that's interesting is it's not just microRNAs, but actually in this E5 fraction, they found lots of long non-coding RNAs. So this is like genetic material that is kind of sending signals and communication between the cells through these extracellular vesicles and exosomes. So yeah, and there's plenty of other studies showing how stem cells are very important for tissue repair, and that also stem cells have these paracrine signals where they're secreting all kinds of things, growth factors, cytokines, and they're regulating other cells by sending these signals. Here's another study where the cells are having paracrine effects from stem cell derived microvesicles and exosomes. And here's another study where they were looking at hypothalamic stem cells, and this was controlling aging speed partly through exosomal microRNA. So these other studies are supporting what Harold Katcher was claiming with the exosomal fraction with those from the young pig to the rat. And also very recently in 2023 and 2024, here's two different studies looking at lifespan from these kind of like young blood and young plasma treatments. So here on the left, there's a lifespan curve, and here they actually did the parabiosis where they surgically connected the mice, and the mice were attached for 3 months and then detached. And 20-month-old mice were connected to 3-month-old mice. And you can see the control line in red, the young, the mice that were attached to the young mice in purple, and there was a 6-week extension in median lifespan there. And then on right, instead of doing the parabiosis, they just simply did young plasma injections into rats, and they saw a significant lifespan extension there. So they started these injections when the mice were already old, 25.6 months old, and this was repeated every other week until death. And the mice lived 2.2 months longer on average. And remember, rats only live about 2 to 3 years, so that's a significant amount of lifespan extension. And here's a photo from that plasma injection study. And so on the left, you have the treated rat there, which was much healthier. And so these type of studies have not just been done in rodents, but there's also quite a few studies in humans. And I won't go through all of these, but basically some preliminary clinical trials. I don't think anybody has already gone through all 3 phases of the clinical trials and had these types of therapies FDA approved. But they have done like phase 1 and phase 2 clinical trials using young plasma to try to treat things like Alzheimer's. I think that one was done by Stanford, and they've tried to treat Parkinson's. And so far, the safety profiles look good, and the results look encouraging. So now they need to expand the trials, make them larger, to determine the full efficacy in a larger study. So the trial finds blood plasma infusions for Alzheimer's safe and promising. And that was from Stanford University there. Also, people have done other types of stem cell treatments too. So allogeneic mesenchymal stem cells ameliorate aging frailty. And this study here was actually done right here in Miami as well. And so it just kind of shows the rejuvenative effect of stem cells. But I mean, we have to remember this can be risky. These types of young plasma and young blood treatments, they have to be done in a proper way. So in 2019, the FDA gave a warning, warning consumers against receiving young donor plasma infusions and saying that they're an unproven treatment. I mean, there hasn't been a full clinical trial that's been completed with this yet. And so proper clinical trials need to be done. And so we're trying to do a clinical trial right here at the Maharaj Institute. And it's also, I mean, you don't want to get this therapy done by just anybody. You have to make sure that the blood type compatibility between you and the donor is appropriate so that you don't have severe immune reactions and complications. And you also want to make sure that the donors are screened for infectious diseases like AIDS and other infectious diseases. You don't want to get a disease from the therapy. So we have to be cautious about that. And then with that, I'll hand it back over to Dr. Maharaj.
Thank you for a nice presentation explaining the scientific basis of it. So what I want to do now in the end is really go into a little bit more detail to explain to you what we're actually doing. And so the title, again, our study, which is unique, which is different to the study which was done in Stanford. And the other clinical trials is basically we're utilizing a protein called GCSF to release the stem cells from the bone marrow of the young donors. And in these donors, we collect their stem cells, we freeze it. But we take their plasma, and their plasma contains the cytokines, the growth factors, and the exosomes, and the extracellular vesicles that Kurt talked about have been done in some of the animal experiments. So the other aspect of what we're doing is when we are born, we have, if we look at our blood, what we find is if we look just at the proteins in our blood when we are born, we have about 7,000 proteins which are all helping us to stay young and helping our cells to grow and to stay young. But as we get older, then the numbers of these growth factors and different proteins, it decreases. And in some of the studies that have been done, it's been shown that when you look at the blood, there's a difference of about 476 proteins which have been altered in the older person compared to the young person. And so as these 476 plus proteins appear coming from senescent cells, it's causing the other cells within our body to decrease their function. And so what we want to do is to be able to find a way to be able to get rid of the senescent cells. Now, in a young person, their immune system is actually quite strong. So if senescent cells do arise, then they're actually destroyed by the cells of the immune system. Some of these cells are called natural killer cells. There are also T cells and B cells. And so our goal is really to be able to change the environment of the individual and improve the immune function. So it's the immune system that's actually destroying the senescent cells, and it then allows the normal stem cells of the individual to grow through. So our study, it's a phase 1, phase 2 clinical study evaluating the safety and efficacy of fresh frozen plasma from young healthy donors ages 18 to 35 who've received GCSF, or granulocyte colony stimulating factor, to ameliorate frailty and enhance the immune risk profile in older individuals. This is a phase 1, phase 2 study. Safety is the primary objective. The efficacy is that we're looking to measure the frailty index, and we're looking to measure the immune function of the individuals to see an improvement in that. We don't know if it's going to work, but it's there as an efficacy outcome. All the studies that have been done so far would indicate that it could. But if you were to ask me today, anyone in the audience was to say, has it worked? We don't know. We need to complete the study, and we need to complete the 30 subjects in this phase 1, phase 2 study. Then we will analyze the data. Then we'll be able to answer that question. But until then, it is still a clinical trial. Our study is under an FDA IND. When you're doing a new type of treatment like this, you have to ensure, first of all, it's safe. Then you go for an improvement in the outcome. And that's why it's a phase 1, phase 2. It is approved by the IRB, and our presentation and the slides that we're giving have been approved by the IRB, and because we are recruiting. This is a recruitment lecture. We are looking to identify, to create the awareness. We want people to become interested. We want them to have a desire, and then we want them to act upon it and call us. And then we will evaluate to determine if they're eligible to be in the study. So eligibility for the study, we're looking for individuals between the ages of 55 and 95. They must have evidence of a clinical frailty score. That is, they must have, which measures physical or cognitive function, their ability to think, mobility, quality of life. Or if their immune system is abnormal, then that, and satisfies certain particular parameters, which would include immune senescence, then they're eligible for the study. We talked about measuring frailty as an outcome marker, and we're measuring a frailty index. When you go into, when someone is given a drug for, let's say, hypertension, that drug determines that it has been determined by using with many studies to show that it works. Well, if we are going to be able to say our treatment worked, we have to use a validated index. And the frailty index that we're using has been validated because it measures nutritional status, energy, physical activity, mobility, grip strength, cognition, mood, and mental health. And that's the reason why we have been, when our study was approved, we were asked to put together an index which has been validated to show that if there is an improvement in this index, then we would be able to say that there is efficacy. But the primary objective of this particular study is safety. So we are also looking at 100 different markers within our study to be able to see if we can see other things, including the frailty index that's improving. We're looking at the aging clock or epigenetic markers of DNA methylation. We're looking at telomere length. We're looking at inflammatory and anti-inflammatory proteins, cytokines, growth factors, and hormones. We're looking at immune senescence markers, validated markers of aging of the immune system. We're looking at that. We're looking at the numbers of stem cells that are coming from the individual, the young donors, and the factors that are present in them. And then we're looking at biochemical markers of mitochondrial function and aging. So it's a very ambitious project. First of all, in our study, we're looking for donors. That's young donors. We're also looking for financial donors as well. But Dan, who represents the foundation, will talk about that. So the donor process is if we have someone between the ages of 18 and 35, if they're interested, then we will evaluate them. They will undergo a screening process. And then if they satisfy the screening process to ensure that the plasma we're getting from these young donors have been screened appropriately according to the protocol requirements, then we will select them. Because again, we want to ensure the safety of the individual who is receiving it. The donor receives the protein, a natural protein, GCSF, for a number of days, and then they undergo an apheresis procedure where we collect the plasma, and then they are followed up for a period of time. this gives a schema of actually what happens. You have the healthy donors between the ages of 18 and 35 who are very happy to be able to help because they want to help the aging population. They undergo the apheresis procedure. The plasma is separated. This looks like the yellow product that you see in the bag. And then that's infused into the aging subject. And the aging subjects have got to be between the ages of 55 and 95. As I said to you before, this study is in a phase 1, phase 2. I just put here the processes that normally occur when you're going through, because we are developing this as a drug. It's called a young blood plasma, but it requires to go through an investigational new drug application process. And that's essentially the process that we're following. And this just gives the timeline, phase 1, phase 2, phase 3. And if it passes phase 3, then it goes in for a submission for an approval. And when it's approved, then it could be used as a treatment to overcome this issue of aging or frailty, for which, as far as I'm aware in the literature, there is no other treatment that treats the root cause of the problem. It just treats the symptoms. So thank you for your attention. Again, our goal today was to make you aware of our study. We wanted to make sure that you learn as much as you can about it. And if you're interested, then contact us and let us know, and then we can help you. Could you just hold the questions? Because I'd like to now invite Dan Mangru to come up and say a few words, and then after that, we'll have Dr. Flynn as well.
Well, thank you so much for having me here. And thank you to Dr. Maharaj for inviting me. Although when you invited me, you didn't tell me it was going to be a costume party. I might have dressed a little differently. Should have known. But, and then also, contrary to how I was introduced, I'm the only one that's not a doctor that's speaking today. Didn't even play one on TV, So, but I will say, though, didn't even play one on TV, but I'm here because all throughout my life, I've had a natural curiosity. I've always been interested in how the world works, how things kind of fit together. And I've always kind of wondered about what's out there and what's in the great unknown. When I was 14 years old, I was recruited by NASA for their Young Engineers program for the NASA Nurture. At 16, I enrolled in university. And I've always wanted to just learn and learn. And so that eventually, as Dr. Maharaj said, led me to a career in media, where I was the host and executive producer of a national television show on primetime cable news. And then during that time, actually one of the viewers of my show had actually wrote to me, and they said, hey, there's this doctor, he's doing amazing work down in South Florida, and you have to meet him. And, so I said, sure, why not? And so that doctor was Dr. Maharaj. And when I went to his facility in Boynton Beach, it changed my life. Because I saw what Dr. Maharaj was doing, and he explained to me what his central thesis was, which if you listen to Dr. Maharaj earlier today, you'll be able to hear that the central thesis that he has is that the immune system is at the very heart of our health and of disease. And if we can control the immune system, if we can keep the immune system healthy, we can be healthy. If we can keep the immune system strong, we can keep disease at bay. And it is that central and fundamental thesis that has guided Dr. Maharaj throughout all of his work and all of his scientific and academic research that he's currently undergoing today. And, when I met Dr. Maharaj, he invited me to join his foundation. And so I've been a 12-year board member of Dr. Maharaj's Stem Cell Cancer and Regenerative Medicine Foundation. And I've been very proud of the work that he's been doing with the clinical trials, and very proud of the work he's been doing both in research as well as clinically treating patients. And I've had the distinct pleasure of meeting hundreds of Dr. Maharaj's patients. Hundreds, I kid you not. And I've seen them all. I've seen I've seen I've seen the couple who comes to us where the wife is, has serious immune dysfunction, also has neurological disorders. And, when she comes and they focus on the immune system and Dr. Maharaj is able to treat the immune system, we see significant improvement. We see all of a sudden now that a husband can look at his wife and she can smile back at him instead of having that empty look sometimes when you get that far down the line in disease, that all of a sudden now you can feel like you have your life partner back. I've seen also the families who've brought their loved ones here, both on the proactive side and, banking and storing their stem cells, as well as with dealing other life-threatening diseases, such as cancer. But I've also seen the other side, for all the success stories that are out there and for all the good work that Dr. Maharaj has done, I've also seen the people who come to Dr. Maharaj as the last method of resort, where it's not years to live or even months to live, but days. And those folks who have tried all the other doctors, tried all the other therapies, and where time is too late, what we hear is that I wish I would have done this. I wish I would have done that. And when we live here, we don't want to live by wishing we had done something else in life. We want to make sure that we live life, we live it to the fullest, and we have no regrets. And that we optimize every single life and every single minute and every single cell that we have in our bodies. So why am I here? I'm here on behalf of the foundation, which, as any foundation obviously does, we want to be able to raise the funds needed to help fund the clinical studies. And as they say in the world of foundations, we want people to give and then give till it hurts. And then after that, you give some more. But there's an interesting thing that happens. Is that after you give and then you give till it hurts and it hurts some, and then you give some more, you start to feel good. And why is that? It's because we're all here because we want to have value greater than ourselves. We want to be a part of a mission and a cause that is greater than who we are as individuals. And that through our own efforts, through our own talents, and through our own time, we can achieve these goals of which we set out to do. So with Dr. Maharaj's work, there's several ways that you can contribute both your time, your talent, and your treasure in order to help advance the cause of aging. So first off is going to be if you are a young, healthy donor that's between the ages of 18 to 35. As Dr. Maharaj had mentioned, what we're looking for is you actually can help contribute, your plasma, as he described before, and what that can be. It could be somebody in this room. It could be the child of somebody in this room, a family member of somebody in this room. If you know somebody who is young and healthy, who you think can be, beneficial to the study, that's something that we're looking for. Then there are also the study participants. So if you yourself meet the criteria, ages 55 to 95, have immune senescence, also there's meet the criteria for frailty, we would like to talk to you because we are looking for people to be part of the study, people who want to be proactive and who want to take their health and their longevity into their own hands. And that's why we're recruiting those health-minded, longevity-minded individuals to be part of the study. And then, as Dr. Maharaj has said before, these are clinical trials. And so in a clinical trial, you actually cannot charge somebody to be part of a clinical trial. So everybody who enrolls in the clinical trial enrolls and receives the healthcare the trial medication and the treatment free of charge. So every single participant in this study will receive the treatment free of charge. It's an amazing opportunity. And so with that, what we have to do is the treatments are essentially paid for by donors. And so it's through the kindness and the generosity of people like yourselves in this room that we're able to do the research that can help change lives. And not just the lives of a few, handfuls of people that are in the study, but ultimately the lives of billions around the world. Every single one of us at some point will come to meet aging. And as we've learned in research, aging is not an inevitability. Aging is a disease. And if aging is a disease can be treated. And that is where Dr. Maharaj is. He's on the precipice of being able to treat the disease of frailty. And that's why he has this study that he's created. So what we ask everybody to do, there's a QR code that's here. We invite everybody to put your cameras up, scan the QR code to get more information on the study and all the work that Dr. Maharaj is doing. If you don't have your cell phone with you, you can go to regenerativefoundation.com. I'll say it again, regenerativefoundation.com. And the third time, because third time's a charm, regenerativefoundation.com. Now everybody's going to remember there's going to be a quiz at the end of the talk, regenerativefoundation.com. So write it down somewhere. You might even get a prize. But be sure to do that. Scan the QR code, be able to get more information about the studies, how you can contribute, how you can sign up to be a participant, a donor, or even if you wanted to make a financial contribution to the study as well. And so in closing, what I will tell everyone is that as we sit here in the Church of Perpetual Life, I wish you all a good evening. I wish you all a good life, but also I wish you all good fortune, and fortune to be able to impact the lives of so many around you as you gather together communally and be able to reach an impact far beyond the people who are here, but also far beyond our days. And when we look at the creed, to have perpetual life is to be able to live far beyond our years, and that's through our legacy. And as we take this journey of life, I ask you all to join us and to help us create a legacy of life and of health. Thank you very much. And now with that, I will introduce, I was from Florida Atlantic University, is where I went to school, so my fellow FAU, he is Dr. Dan Flynn. He is a doctor, unlike me. Sorry, guys, you're not a doctor. But I want to introduce him here. He's going to say a little bit more words about the research and about also what Dr. Maharaj has been doing. So ladies and gentlemen, Dr. Dan Flynn.
Thank you, Dan. Thank you. I really like in your creed the quote attributed to Arthur C. Clarke, "We don't know what's possible until we explore what's impossible." And throughout my career as a cancer research scientist, I've been consistently surprised at the secrets and the possibilities that bone marrow cells hold. I remember early on in my career, I met this physician from Duke, and he had a patient he was telling me about who had both leukemia and he had severe diabetes. And the diabetes, he had necrosis in his foot, and he was having lots of trouble. But the leukemia was severe. So they did a bone marrow transplant on this guy by getting a donor. A woman donated her bone marrow cells to this individual, this guy. He received it, and over time he got better. Amazingly, the diabetes necrosis in his foot got better. And they were like, what's going on here? So they saw new blood vessels in the foot. They pulled some of the blood vessels, examined them, and they found those new blood vessels in his foot had the genetic material of the woman. And what that means is that blood vessel cells don't grow from other blood vessel cells. They come from your bone marrow. That was totally surprising at that time. I remember later having lunch with a couple of pathologists, and I was talking about my work with cancer and solid tumors, and they said, well, when we do an autopsy on a table and we open up a patient, regardless of how old they are, we'll always find a small tumor in there, leading them to surmise that we all have cancers. It's our ability of our immune system to clear those cancers. That was a surprise to me as well. And now over the last 10 years, I'm seeing the secrets that stem cells have in helping to be employed to use to treat cancer. This is going to be the subject of a Nobel Prize one day. I'm certain of that. But the latest surprise to me was the work of Dr. Maharaj. Because we all know as we get older, our immune system drops, we're more susceptible to flu and other diseases. And we also know that we get a little more frail and achy. But who knew that those two conditions might be linked? And so what his studies show is that he can take a young patient, inject them with this very safe growth factor, and then isolate from the serum and the blood factors that they give it to an older patient, and the older patient's immune system can be boosted. That's great, but the frailty goes down. The mobility is being addressed. This is amazing because it tells us that there's something in our serum that can be used to treat patients' immune system and their mobile health. And so one day, what's possible from this is that we may identify what that factor is. That factor may be manufactured in a facility, administered to patients. Maybe one day it becomes a pill. Maybe one day it's over the counter. So you don't know what's possible until you start to explore these things. Dr. Maharaj is very close. I think he needs something like 30 patients to get involved in this study, show the FDA that there's something there, and then they're off and running, and they're looking for that factor in the serum. So I'm really proud to be associated with Dr. Maharaj's clinic and his outstanding staff, because they're doing work that's really going to be impactful for people. And so, again, you don't know what's possible until you explore what's impossible, and they are rapidly moving down that road. So thank you for your work, Dr. Maharaj.